So continuing back on intellectual disabilities, we want to take a brief look at causes of intellectual disabilities. Now, there's some differences in terms of risk factors that can contribute to intellectual disabilities and the timing of when the disability occurs. This is one of the few disabilities that we look at in terms of timing. So we have some that can occur prenatally. So we have some chromosome abnormalities. For example, Rachel has Down syndrome. That is a chromosome abnormality. Turner syndrome is often identified as a prenatal intellectual disability. Lots of different things that can occur prenatally. Even different structures of the brain that get modified slightly prenatally can contribute to this. When our daughter Josie, when I was pregnant with her, she was actually diagnosed with Dandy-Walker malformation, which is at our 20-week ultrasound. They identified that the two hemispheres of her cerebellum were not connected. She was missing that part that connects those, and that can cause all kinds of different issues. And so for her diagnosis was prenatally because of those different structures in the brain. There also can occur trauma at birth, or there can be extreme prematurity that contributes to an intellectual disability. So if we know that a baby is born at that 24 to 28 week mark, we now are able to have some pretty high success rates within NICU units on supporting those babies as they get to full term. But we also know that prematurity can contribute to an intellectual disability. In Phil's case, his diagnosis occurred perinatal. So he had trauma at birth. The umbilical cord got trapped against his head and cut off oxygen. And so my mom had an emergency C-section, but his brain did not have oxygen for a length of time that contributed to his intellectual disability. And then postnatally, we can get a traumatic brain injury that contributes to an intellectual disability, or sometimes we can have an infection that damages the structure of the brain and causes that. When we look at risk factors, of course, we've talked about chromosome abnormalities, and those can all be tested for before birth so that we know if an infant with, for example, Down syndrome, that infant has that in utero, and parents and medical staff can be prepared to deal with any kind of issues that come up during birth. Socially, we know that if a mom uses alcohol frequently, has alcoholism or drug use during pregnancy, that can contribute to an intellectual disability. No prenatal care can also impact that. And the other thing that research has shown is tying in mothers who have less than a high school education, so they didn't earn their high school diploma, are more likely to have a child with an intellectual disability. So I think it's kind of important to understand these causes just because it gives you a little bit of background when you're working with these students on maybe what contributed to their intellectual disability. When we look at assessment and look at identifying students with intellectual disabilities, this is pretty clear cut. When we look at identifying a student with a learning disability, we're typically going through a response to intervention process, really looking at where gaps are, looking at what subject areas they struggle with, but we don't necessarily have really specific tests that every school uses to identify that student with a learning disability. When we're talking about intellectual function and assessing that, we have some pretty specific tools that we can use to do that, and that's with IQ testing. The Wechsler scale is the most commonly used scale to obtain an IQ score on a student. And then we have the Diagnostic Adaptive Behavioral Scale, which is the DABS scale. And this evaluates those adaptive skills that we looked at in the last video and looks for gaps that the student may have. Now, for example, Josie's going through a whole host of assessments right now because we're getting ready to do that developmental delay waiver. She's doing the Wechsler scale so they can give her an IQ score. And then we're looking at that Diagnostic Adaptive Behavioral Scale, the DABS, to look at those adaptive skills and identify the gaps. Now, if you work in middle school or high school, that transition planning inventory that the text mentioned is a really good assessment tool to turn to because it not only gives you kind of some ideas on where gaps are, where areas of need are, but it also really gives you some great information through the inventory on identifying goals and skills that you can work towards for transition. So I included that here because I think that's really important for you to know if you work with middle school, high school students and you're going through that transition process with them. When we look at placement, the text offered some information on this. I think that was really helpful just to consider where students are placed that have intellectual disabilities. You'll notice that almost half of students with an intellectual disability are placed in a separate classroom. 26% are in a resource room setting. So we're looking at 75% of these kids, at least at a minimum, if not more, are not in an inclusive setting. Now, for some of these students, that is the proper placement. But I think it's important for us to ask ourselves if that is correct for the students that we're working with, to make sure they have as much access to inclusion as they possibly can. When you read about Rachel's story and you see what inclusion did for her, and having those high expectations, having teachers that would make accommodations and modifications for her to be successful in their regular education classroom, it made a significant impact on where she is right now as an adult, as an 18-year-old. So it's really important to think about. And then 6% of students are in a separate school. Josie would fall under this category because she goes to the school for the deaf. And then you have a residential facility or hospital homebound programs. Okay, really small percentage of those students, but we do have students within the state who are in those kinds of settings. We have teachers in this class who are teaching in those kinds of settings. So what I want you to do next is I really want you to watch that video just like you. Rachel is in it. There's also 2 other children with Down syndrome. And then there are typical developing peers that are in it with them, talking about developing friendships with them, talking about the characteristics of children with Down syndrome, really giving you a good insight into these kids. And then the discussion forum really is going to be focused on that video. The chapter review questions are going to be focused on the chapter, this video that you watched, some of the additional material I talked about, and the blog post with updates on Rachel. So really take some time to look at these closely and gain a really good understanding of these characteristics of students with intellectual disabilities that you're working with in your classroom.